I'm Sabrina. I'm going to be checking off Megan today on the ear, nose, and throat.
Hi, my name is Megan Hall. I'm a student at Liberty University. What's your name?
Lauren Richardson.
Nice to meet you, Lauren. Well, I'm going to be checking off your ears, nose, and throat today. And I'm going to start out with your ears. So if you could just pull your hair back for me. Alright, so I'm just looking at the outside of your ear. I do see a little primary lesion right there, which is just a small macule, which doesn't look unhealthy or irregular, which is good. The structure of your ear seems normal. You got a helix, tragus, antitragus. The coloration of your ear is also normal. It's a good skin tone. I don't see any redness or bleeding. Alright, now I'm going to look into your ear with the otoscope. You just let me know if you feel any tenderness, alright? Alright, you have minimal cerumen, which is good. I do see some like flakes, but that's fine. Alright. Any tenderness there?
Mm-mm.
Okay, good. I also don't see any redness or bleeding or foreign bodies, which is great. Right now I'm looking at your tympanic membrane. It looks nice and healthy. It's a good pale color. I don't see any edema or perforations. I also see the umbo, which is at a good angle, and it also does not have any like redness or swelling on it. I don't see any scar tissue, which is great. Alright. I am unable to see the cone of light, but if I could, it would be towards the bottom of my visual view here. Alright, looks really good. And then normally I would look into your other ear as well. There you go. I'm going to throw this away. Alright, so next we are going to do a hearing test. I'm just going to put this at the top of your head, and then you let me know if you can hear it equally in both sides of your ears, alright?
Yeah, then both.
Equally in both?
Mm-hmm.
Alright, if you could hear it more, let's say in your left side, I would have you plug the left side of your ear up. We would do it again and see if you can still hear it, if you hear it more like in that left side or not. And if you did, then that would be normal. Okay, next we're going to do the RIN test. So if I could have you just push your hair behind your ear again. Alright, you just let me know when you don't hear it anymore, right?
Okay.
Alright.
Okay.
Alright, your bone conduction was about 10 seconds, and your air conduction was about 30, which is great because normally we would want a 2-to-1 ratio, and you're about 3-to-1, which is really good. Alright, next we're going to move on to your nose. So basically I'm just going to look at the outside of your nose right now. You have great symmetry. I don't see any discoloration or lesions. Let me see here. Yep, everything looks good. Alright, now I'm going to look inside your nose. Here we go. Alright, ready? Okay. Alright, I do not see a deviated septum, which is really, really good. The coloration of your nose is good. It's like a light pink color, which is normal. I don't see any foreign bodies or bleeding. No edema and no lesions on the inside of your nose, which is great. Alright, next we're going to move on to your mouth. Oh, wait. Alright, can you plug one side of your nose, please? And then just inhale. Okay, and then do it on the other side. Alright, awesome. Alright, now if you could just close your eyes for me, plug one side of your nose, and just let me know what you smell, okay?
Coffee.
Okay. Now plug the other side. and smell.
Vanilla.
All right, great. So you passed both of those. All right. Next, I'm going to look inside your mouth. First, I'm just going to look at the outside of it. All right. Your lips look really good. I don't see any like dry, cracked lips. They look nice and moist and pink and symmetrical. I also don't see any lesions, no herpes or any type of things like that. I'm just going to pull down your upper lip, or your bottom lip. Alright, that looks really, really healthy. I don't see any lesions there either. You got a nice, good pink color. Looks really healthy. Alright, if you could just open your mouth really wide for me. I'm going to look back here and push your tongue down. Alright, and you do not have tonsils. When did you get them taken out?
3rd grade.
Okay. Alright, so next I'm going to have you open your mouth really wide again. I'm going to check your hard palate. Let's just feel it. Alright, you have a good ridge up there, which is nice and healthy. Alright, just open your mouth. Okay. So I'm going to check the Stenson duct. Does feel good. Oops, sorry. Feel nice and smooth. Now I'm going to feel your Wharton duct under your tongue. Alright, those also feel good. And while your tongue is there, I'm going to look at your frenulum. Put your tongue to the roof of your mouth. Alright, great. That looks really good and intact. And I'm also going to look at the frenulum in your upper lip, which also looks good. Alright, next I'm going to check your buccal mucosa. So this is just going to be like on the side of your mouth around here. Alright, that looks also really good. I don't see any lesions at all. It has a nice healthy pink color. I don't see any bleeding. Overall, the hygiene of your mouth looks really, really good. Really healthy. Your teeth are nice and white and straight. I don't see any cavities or any decay in your mouth, which is really, really good. If you can open your mouth and say ah for me. Alright, great. Your uvula does move when you do that, which is a good sign. Alright. One thing that I did not do yet was actually for your ears, which is the whisper test. So basically what I'm going to do is I'm going to whisper 3 things and then you just repeat it back to me, okay?
Okay.
Alright.
1, 2, 3.
Alright, good. Now I'm going to do it on the other side.
ABC.
Alright, great. So you passed that. Alright.